Hello, dear friends. I'm Dr. Prashant Pillai. This time I'm here with you to project a video on root canals. There are a lot of my patients who are very much concerned about safety of root canals, about the success of root canals, and a host of other things in relation to root canals. So I thought it's important that I speak to you all about root canals, what I think about root canals, and whether it is the right choice for a problem which you are facing with respect to your dental issues. So, what exactly is root canal treatment? Now, let's see. You can look at these slides here. You can see the cross section, the longitudinal section of the tooth, where you see the core of the tooth, which is the root canal. This is what this portion is called, the root canal. And the root canal is nothing but a neurovascular bundle, which means it is a collection. It is a collection of nerves and nerve cells and blood vessels, which enter from the surrounding bone through the root of the tooth. So it comes in through a small narrow hole at the tip of the root, and then it ascends up through the root canal through the root of the tooth and comes to the pulp, which is the core of the tooth. So that is where the problem begins very often. So this is the structure of the root canal, which is seen here in the pictures here. You can see the structure of the root canal. On the left hand side, you see the root canal structure of a central incisor, that is a front tooth. You have the root canal structure of the premolar and the lower molar, the lower premolar and lower molar. As I've mentioned earlier, you can see the neurovascular bundle, which is entering from the root tip and ascending up through the root and coming into the pulp and forming a network here. So this is what a root canal is. Now, why are people so scared about root canals, and why are people saying that root canals are dangerous and this and that? This is something which I thought I should address about. Now, what exactly happens? Now, why do you need a root canal treatment? Let us look at that. Now, this is a healthy tooth. As you can see, you have the crown, you have the and the roots here. The crown, this is the longitudinal section of a molar tooth. You have the coronal portion or the crown, which is seen outside, and the root portion is always inside. It is embedded within the bone called the alveolar bone. And then you have the blood vessels deep down, from where you have the neurovascular bundle coming in and the network forming here called the pulp. Now, when a cavity develops, it starts from the surface. Now, how does that happen? You have grooves, depressions, and elevations on the tooth surface where food tends to accumulate. And wherever food accumulates, you tend to have bacterial colonization. The bacteria eat into the enamel because they secrete a lot of acids as byproducts of bacterial metabolism. The acids eat away the enamel, which is predominantly a calcium salt, and a cavity develops. So in the cavity, food entrapment happens, and more number of bacteria colonize. They keep multiplying, and there is a enlargement of the cavity happening. It just progresses, and in the initial stage, when the cavity is confined to the enamel, there is no pain, no discomfort of any kind. But the moment it enters a pulp, you start experiencing sensitivity and discomfort. Now, once the sensitivity and discomfort sets in, the patient reports to the doctor, and the doctor says, no, we have to do a filling, and we may have to provide you with a temporary filling initially, and then we'll give you a permanent filling after say a month or two. But very often the patients, depending on their attitude and the way they look at things, they feel that it's not necessary. They just walk out, and then they come back with pain by when the cavity would have progressed into the pulp, and the pulp becomes infected, and the patient is in terrible pain, severe pain. And at this point, the patient rushes back to the doctor. When the doctor puts him on antibiotics and anti-inflammatory drugs to control the pain, and then says, now, my friend, you have to undergo a root canal treatment, which is going to cost you so much. And then you also need a crown, which is going to cost you a lot more. So you can imagine, in the normal course here in our center, we generally charge around 1,500 to 2,000 rupees for a normal filling. But for a root canal treatment, it works out to minimum 5,000 rupees. And then you need to put a crown, and if you want that tooth look like a very natural tooth with a very good result, then you need to go in for a zirconia crown, which is really expensive, and it can work out to around 20,000 rupees to restore a single tooth with a root canal and a crown. So you can imagine, from the point where you could have spent just 2,000 rupees to solve a problem, you ended up coming to a point where you need to spend 20,000 rupees to save a tooth. So this is the advantage of addressing dental problems early. Now, very often what happens, the patient undergoes the root canal, but at times patients just turn away once the pain is under control. They're least bothered about coming back for treatment, and by then the infection would have spread to the root tip, and then it spreads out, and that's how you develop swellings like what you see here. So this is what we call a dentoalveolar abscess. So you are complicating things by waiting and prolonging your treatment, and you end up in a mess. So at this point, you have only two options. One is to pull the tooth, to extract the tooth and then put in implants there, or the other option is to go in for a root canal and put a crown. That is all. That is the only option. So earlier the treatment, lesser the trouble, lesser the medications, and lesser the pain the patient will suffer. That is the advantage. So I hope you understood what root canal treatment is. I've given you the fundamentals of root canal treatment. And if you like the video, certainly you have to press the like button, and do share this with your friends, because a lot of people are confused about root canal treatment. Now, I'm also doing another video on failures of root canal treatment, which is extremely important because a lot of people have concerns about failures. So the video on failures will follow. Thank you very much.